Hi guys, afternoon. Good afternoon. Okay, so today I'll be talking about acquired immune deficiency syndrome, which is AIDS in short. Alright, so these are our agendas. We'll discuss of the definitions, background, etiology, phase of HIV, opportunistic infections associated with AIDS, modes of HIV and AIDS transmission, protective ways, clinical manifestations, tests that can be taken as well, and the conclusion. Alright, so definitions. AIDS is the disease that is caused by HIV virus. We all know that through infection, which weakens the immune system. While HIV is the actual virus that primarily infects the cell of immune system. The background of HIV and AIDS. So, human immunodeficiency virus has a specific type which is called the retrovirus. And HIV invades like T helper cells to replicate itself, and there's no cure for it. While acquired immunodeficiency syndrome, this is the disease that is now caused by this virus, the virus called retrovirus, right? And this limits the body's ability to fight infections and weakens our immune system, and also there is no cure for it. Etiology and the risk groups of these AIDS. So virus is found in all biological fluids such as the blood, semen, vaginal secretions, breast milk, and cerebral fluid. And then we also have main risk people are like homosexual men, because there's no protection of homosexual men, and then intravenous drug abusers who basically share needles. There's no antiseptic processes being done, there's no preventions being done by those people. And then transfusion recipients, and then because foreign bodies are entering your body. And then we have heterosexual contacts, maybe there's cuts on your lips and so on, because we said it passes through all human fluids, right? So, and then infants born to female drug abusers as well. And then phases of HIV, there are about 3 phases. We have asymptomatic stage, we have symptomatic stage, and also the main HIV and AIDS stage. So, where it basically leads to, like, the final stage is the AIDS stage. So now the asymptomatic stage is basically the signs you can see in the patient or in someone with it is short flu-like illness, and you can also see like swollen hair, lens, and also fatigue, diarrhea, weight loss. You can also see fever, chills. This lasts usually like from 1 to 6 weeks after infection, and then there's no the symptoms are not very severe, so they are not really, and then also the infected people they're basically carriers. They can cause infections to others, and it can last maybe for 10 years. An average of 10 years is the period that this phase can last. And then basically the HIV virus can be detected in your blood. And then the symptomatic stage, this one is where the symptoms are worsening. The fatigue is now extreme. The person is just sweating, and the weakness, like the weight loss, is very extreme. I think you saw the first picture on my presentation. That was a sign of now the final stage, which is the HIV and AIDS stage. So while the symptoms worsen, we also have mental changes such as forgetfulness, abnormal thinking of patients, and then also for the AIDS part, the immune system weakens very terrible, and there is now emergence of opportunistic infections and also cancers, and then the illness become more severe, leading to an AIDS diagnosis. So this is an example of opportunistic infections associated with AIDS. We have bacterial and viral. So we have tuberculosis, pneumocytosis, pneumonia, viral Kaposi's sarcoma, pupil red, which Derek spoke about, and also we have influenza. And then modes of transmission of HIV and AIDS, there are about 4 that I've mentioned in this presentation. So we have through body fluids, through mother to child, and then also through injections, intravenous injections, and lastly through like sexual contacts. So through body fluids we have blood products, semen, vaginal fluids, breast milk, I've mentioned this before, and then through mother to child, this is through maybe during birth, maybe during before birth even, and sometimes postpartum after the birth when the child is drinking the milk from their parents, the mom will. And then through intravenous drugs use, maybe sharing of noodles. Remember I said that drug abusers who share noodles, they do not know anything about antiseptic processes, so they can basically, and also they do not know, they don't have tests, like they can't confirm who has it and who doesn't. So through that also, without sterilization, and then increases the chance of contracting HIV. And then also through sexual, through oral, anal, digital, and I don't know. Yeah, continue. Sorry? After. Continue, please. Mechanism of beginning of AIDS. Alright, so we can see that it starts off with T lymphocytes. The main target cells are the CD4, which are the T helpers, and T lymphocytes. And then we have B lymphocytes, macrophages, glial cells, and intestinal epithelial cells. The main target for the HIV virus is actually the T helpers, because they literally affect the phagocytosis process. They affect also the immune defense, and also humoral defense. So they basically control everything. They're like our mini brain for immune deficiency. And then, so what happens is the target cells have polymorphisms, like in CCR5 gene or other alternative viral code receptors such as the CCR2. And I'll explain the mechanism on the next slide. Alright, so the life cycle of HIV, you can see that the virus is literally, okay, so on the first stage, you can see that there's a free virus entering just entering the immune system, I don't know through what. And then number 2, we now see that virus goes to its target cells. We mentioned them before. In this case, let's say it's CD4 T helpers. And then now it attaches and then enters the virus binds to the CD4 molecules, and one type of receptor we've already mentioned is the CCR5. And then the receptor molecules are then go infuses with the virus basically. And then after that, the virus now produces some chemicals that it doesn't melt the cell membrane, but it allows it to diffuse into the cell membrane. So the virus then empties into the cell membrane, and then when it empties into the cell membrane, every cell contains DNA, what. So when it enters into the cell now, it then does reverse transcription with our RNA and DNA strands in the cell. And then after that reverse transcription, there is now integration where the viral DNA intersects with the normal cell DNA. And then after that, we now have transcription where now there is the viral protein, the viral strand and the normal cell strand are now forming the double helix of the DNA basically of that cell. And then we can see today in the nucleus. And then they assemble, and then after assembling, the virus is now taken out to go and affect another cell. And then after immature virus breaks free to the infected cell, and then after that there's maturation of that virus, and then after maturation of that virus it goes to a different cell and affects another cell, the same process or the same manner. And then we have clinical manifestations of AIDS. Okay, so we have immunologic, which are basically low white cells counts, opportunistic infections, and lymphadenopathy fatigue. And then we have integumentary, where there's poor wound healing, skin lesions, night sweats, and then we have respiratory, where we have cough and SOB, and then we have gastric intestinal, where we have diarrhea, weight loss, and nausea and vomiting. And then we have central nervous system, where we have confusion. You remember for the second phase, I said that the patient might have a form of forgetfulness. So there's also dementia, headache, visual changes, personality changes, pain, seizures, and we have malignancies, where we've, like Derek says, we have Kaposi sarcoma, we have non-Hodgkin's lymphoma, invasive cervical sarcomas. These are all cancers due to AIDS. And then we have, so for viral infections, we have under immunologic, we have cytomegalovirus and herpes simplex virus. And then for bacterial infections, we have mycobacteria complex and tuberculosis. And then for fungal infections, we have cardiosis and stomatitis, esophagitis, and vaginal. And then we know that for protozoa is pneumonia, basically pneumonia. And the tests that can be taken, just going to list them. We have anonymous testing, where somebody's name is not basically reviewed, and somebody doesn't have to send a name. Basically, they just get the test, and and then confidential testing. This is when you give the name to the doctor, but the doctor doesn't release your name, but puts you on the statistics of people who are HIV positive or negative. And these are mainly used during research. And then oral testing, and then we also have T cell count test. And then why T cell count test? Because we already mentioned that the T cell, part of the T cells, the T helpers are the main target for the HIV virus. Therefore, by counting the T cell cells like in our blood, the amount T cell count test, it allows us to see whether the blood has HIV virus or not. And then we have viral load test and retest. Alright, so we have protective ways. I've mentioned 3 protective ways here. So we have, practice abstinence from sex, and then avoid multiple partners. Have basically monogamous relationships, and then don't share needles, syringe, drug injection, equipment, or any item that is sharp and that might cause blood transfusion from one person to another. So abstinence, guys, you can see from the picture that you should abstain is better. So it is the only 100% effective method of not acquiring HIV or AIDS, and refraining from sexual contact, oral or any other methods is the best, and refraining from intravenous drug use, like what drug abusers usually do. And then monogamous relationships, you can see that so a mutually monogamous relationship with a person who is not infected with HIV, or HIV testing before intercourse is necessary to prove your partner is not infected. So always have tests before you come in contact with anyone. And then protected sex, use of condoms, always use latex or latex, not a natural skin condom. And then always use latex barrier during oral sex. And then make sure you package it. The package is not expired. Just check the contents whether they are in good shape or not of the condom basically. And then never use the condom more, or just use it once. Don't use it more than once. Okay, so in conclusion, conclusion, I would like to encourage all of us to, if you're about to come in contact with anyone, go for testing with that person, your partner, and to make sure it's only one person. And then also abstain from it if you can, because it's only the 100% prevention. And then apart from that, you should also minimize the use of intravenous injections by yourself. I mean, sharing with other people drugs. And yeah, thank you.
Thank you.
Yes, what's the question?
The question, who is the question?
Yes.
Can you tell me the meaning of the digital sex?
Okay. I don't know, right? But digital is fingers, I think, according to Latin. So, yeah.
Yes. So